Hi guys, we are continuing psychiatric section schizo series, and subject of discussion is schizoaffective disorder. By definition, schizoaffective disorder is a serious mental illness that has features of two different disorders: schizophrenia and an affective mood disorder, either major depressive disorder or bipolar disorder. If to discuss in part, schizophrenia is a brain disorder that distorts the way a person thinks, acts, and expresses emotions, also perceive reality and relates to others. Second one is bipolar disorder, which is characterized by cycling mood changes, which including severe highs called mania and severe lows called depression. And depression disorder by itself, which is an illness that is marked by feeling of sadness, worthlessness, hopelessness, and it may also include problems with concentration and remembering details. Schizoaffective disorder is a life-long illness that can impact all areas of daily living activity, including work, school, social contacts, and of course relationships. By statistics, we see that more commonly are affected young women of age 16 to 30. What are the causes of schizoaffective disorder? Of course, genetic, family member who are affected by any of the schizo disorders like schizophrenia, schizoaffective, or schizophrenia form. Of course, family members who are affected by bipolar disease. Brain chemistry and neurotransmitters, low levels of dopamine, which is predominant in a depression disorder, and high dopamine in active or psychosis phases or schizophrenia, which is component of schizoaffective disorder. Environment, viral infection, or highly stressful situations. Drug use, which are altering mind drugs like exciting or depressive. Let's talk about symptoms of schizoaffective disorder. So a person with schizoaffective disorder has several changes in mood, and some of the psychotic symptoms of schizophrenia, such as hallucinations, delusions, disorganized speech, may be present. By psychotic symptoms may include the inability to tell what is real from what is imagined. Symptoms of schizoaffective disorder might vary greatly from one person to the next and might be mild or severe. So, main symptoms are psychotic, mania, and depression symptoms. Let's discuss every in part. Psychotic symptoms: hallucinations, the perception of sensations that aren't real, such as hearing voices. Second one important is delusions, strange beliefs that are not based in reality and that the person refuses to give up even when presented the factual information. When you are trying to convince patients that beliefs are unreal or unexisting. Disorganized or confusing thinking, unusual behavioral, slow movement or total immobility, lack of emotion, especially facial expressions, poor motivation, and problem with speech and communication. Next symptoms are mania symptoms. Everything is increased, especially activity, work, social, and even sexual activity. Increased in and rapid talking, rapid or racing thoughts, no need in sleep, agitation, inflated self-esteem, destructibility, and self-destructive or dangerous behavior, such as going on spending sprees, driving recklessly, or having unsafe sex. Next symptoms, depression symptoms, depressed or low mood, everything is low, low appetite, weight loss or weight gain in a typical depression. Changes in sleep, especially sleeping a lot, lack of energy, loss of interest in usual activities, feeling of hopelessness, guilty or self-blame, inability to think or concentrate, and thoughts of death and suicide. Does exist any of the treatment for schizoaffective disorder? Of course, but it is a long life disorder and persists most of the life. So most important things are for psychosis we are giving, if in the disease predominate psychosis, we are giving antipsychotics. If predominate depressive mood, we are giving antidepressive drugs. And it depends on these symptoms. How about psychotherapy? The goal of this type of counseling is to help patient learn about her or himself illness, set goals, and manage everyday problems related to the disorder. Skill training is generally focuses on work and social skills, grooming and self-care, and other day-to-day activities, including home and money management. Hospitalization is required for psychotic episodes, and especially if patients have suicidal thoughts or plans, or threaten to hurt others. And the last one is electroconvulsive therapy, which may be an option for adults who do not respond to psychotic therapy or medication. But repeating to you, most important treatment is for psychosis phase antipsychotics like typical or atypical, and for depressive mood antidepressive. Thank you for watching. Have a good time.